Zambia signed the World Health Organization Framework Convention on Tobacco Control in 2008. This means that the country should have passed into law the Tobacco and Nicotine Control Bill to respond to the World Health Organization recommendations. But more than 10 years down the line, the bill is still in draft form as debate as to whether it must be enacted into law or not among stakeholders has continued. Christopher Chisi now reports.
Regarding the Tobacco Control Bill, our feel that it's a bad piece of legislation. It's one-sided and does not take into account the interests of the other line ministries like Agriculture, Commerce and Trade. Our feedback to the Ministry of Health and our position as JTI or the tobacco industry is that we need to have a balanced approach on all tobacco matters, taking into account health, agriculture, socio-economic impact, contribution to the treasury. All these issues need to be balanced.
These are the views of Litia Matakara, Head of Corporate Affairs and Communications at the Japan Tobacco International Company regarding the Tobacco and Nicotine Control Bill. But Tobacco Free Association of Zambia Executive Director Brenda Chitinde insists that enacting the bill will address the numerous health and income concerns around tobacco.
Tobacco control is a critical development issue as opposed to merely a health issue and should be prioritized as such.
Notwithstanding the debate, Zambia signed the World Health Organization Framework Convention on Tobacco Control in 2008. This implies that the country ought to have passed the Tobacco and Nicotine Control Bill to respond to the World Health Organization recommendations. But more than 10 years down the line, the bill is still in draft form and Ms. Chitinde is concerned.
Zambia is among the global 184 countries that has ratified the World Health Organization Framework Convention on Tobacco Control, committing itself to domesticate the framework on tobacco control and save Zambians' lives.
The consortium advocating for tobacco-free Zambia is further concerned that over 7,000 people in Zambia die every year due to tobacco-related diseases, while 16% of the population consumes some form of tobacco. What is more worrying to the consortium is the sale of tobacco product around schools in Lusaka, as Aaron Chansa, who is also Executive Director for National Action for Quality Education in Zambia, explains.
We want the new government to immediately ban the sale of these products in the vicinity of schools, and we are very serious. Government must criminalize the sale of tobacco products to minors.
Dr. Teddy Mlenga is a tobacco control expert and is calling for increased taxation of tobacco products and ban on the use of shisha. He begins by explaining the dangers of tobacco smoking.
Tobacco contains over 170 substances. About 70%, about 70 of them are cancerogenous. Cancerogenous simply means they can cause cancer. So taxation must be increased from the current 37.3%. According to WHO advice, Framework Convention on Tobacco, should be about 70% taxation so that the price of cigarettes can go up. So that for our young people should not be able to afford cigarettes.
Given the danger of cigarette emissions to public health, some Lusaka residents are calling for stiffer punishment against those who smoke in public.
Cigarette smoking in public is very bad. The law should be stiff.
For people who smoke when they are around others, they should stop doing that because it is actually very bad.
Even as they are selling their products, they even warn us if tobacco is harmful and people still buy and smoke it.
With the coming of the new Minister of Health, SYLVIA, the Tobacco Free Association of Zambia is keeping its fingers crossed that the Tobacco and Nicotine Control Bill will be enacted into law. Christopher Chisi, 5FM News, reporting.